Hello all you research enthusiasts. Welcome back to the channel. In today's world, where junk food is trending, let's take a moment to explore an important topic that often gets overshadowed: the link between fast food consumption and adolescent overweight issues. It's no secret that junk food is everywhere, and often too tempting to resist. Join me as we unravel the effects of this widespread trend, and discover how it influences the health of our youth. Let's get into it. In today's paper, the research was conducted among 679 adolescents in Jambi City, where information on dietary habits, pizza, hamburger and junk food consumption was collected, along with various social determinants of health, to study the relationship between junk food consumption and overweight issues. Public health research not only focuses on diseases but also extends to studying the social and environmental conditions that can influence human behavior and health outcomes. Health is influenced by multiple determinants such as dietary habits, physical activity, peer influence, food availability, social support, and environmental exposure, which we call as the social determinants of health. In this article, the researchers focus on parents' occupation, working status, especially of mothers, and socioeconomic status when they try to link junk food consumption with overweight. Research like this helps us identify patterns and risk factors so that preventive strategies can be designed early. Every epidemiological study revolves around three core concepts: exposure, outcome, and association. In this study, the exposure was the frequent consumption of pizza and hamburgers. The outcome was overweight among adolescents. The researchers assessed overweight using body mass index classifications appropriate for adolescents. The third concept is the association, which means to study if the exposure and outcome are related. The researchers used a cross-sectional design to study this association. A cross-sectional study collects data from a population at a single point in time. It helps researchers estimate the prevalence of a condition and identify possible associations between risk factors and outcomes. Such studies may be descriptive or analytical. They can also be population-based, occupational, environmental, or prevalence-focused studies. In such type of study, researchers do not follow participants over time. Instead, they capture a snapshot of the population and analyze the relationship between variables. One of the most important measures in epidemiology is prevalence. Prevalence refers to the proportion of people in a population who have a particular disease or health condition at a specific point in time, or during a specified period of time. In this study, the prevalence of overweight in Jambi City is recorded as 23.4%. This means that approximately 23 out of every 100 adolescents, or nearly 1 in 4 adolescents surveyed, were overweight, highlighting an important public health concern. Now let's look at some statistical concepts used in the article. Let us simplify logistic regression. Logistic regression is a statistical method used when the outcome variable is binary or has two categories. For example, overweight versus not overweight. This analysis helps estimate the odds ratio. An odds ratio tells us how much more likely an outcome is to occur in one group compared to another. The logistic regression analysis showed that adolescents who often consumed pizza and hamburgers had 3.17 times greater odds of being overweight compared to those who rarely consumed them. An odds ratio greater than 1 indicates increased odds or higher risk. An odds ratio less than 1 suggests a protective effect. And an odds ratio equal to 1 means there is no association between the variables under study. Logistic regression was used because the outcome in this study, overweight status, is binary, meaning adolescents were classified as either overweight or not overweight. This method allows researchers to assess multiple social determinants simultaneously, including parents' education, occupation, socioeconomic status, and cultural factors. Unlike simple analyses, logistic regression provides adjusted associations, helping identify the independent effect of each factor while controlling for others. As a result, it offers a clearer understanding of which determinants are truly associated with overweight and supports evidence-based public health decision-making. The researchers also use the chi-square test. The chi-square test is commonly used to determine whether there is a statistically significant association between two categorical variables. For example, in this study, one variable could be the frequency of fast food consumption, while the second variable could be the overweight status. The test compares observed values with expected values. If the difference between them is large enough, the result may be considered statistically significant. A statistically significant result suggests that the association observed is unlikely to have occurred purely by chance. To summarize the key findings of this study, The prevalence of overweight among adolescents in this study was found to be 23.4%, Additionally, adolescents who often consumed pizza and hamburgers had 3.17 times greater odds of being overweight. These findings highlight the growing public health concerns surrounding unhealthy dietary habits among adolescents, and reinforce the importance of nutrition education, healthy food environments, and behavioral interventions during teenage years. By studying prevalence, behavioral patterns, and risk associations, public health professionals can identify vulnerable populations and develop targeted preventive strategies. Most importantly, this research reminds us that small lifestyle choices made during adolescence can have long-term effects on health outcomes. Thank you for listening.